Will. I'm Dr. Joseph Agbi, moderator of today's session, and I'm sure we've all seen the information tags and the ads. Today is the first of 5 sessions focusing on mental health, and it's been tagged Rethink, and we're looking at mental health in sickle cell disease. Like I said, I'm Dr. Joseph Agbi, your moderator, and I'm going to be introducing everyone who's going to be participating in this session. Just a little about me. So my background was in Nigeria, studied medicine and surgery, University of Port-Harcourt, graduated early years of practice back home in Nigeria. Currently in the UK, doing my training under the health education in the West Midlands. When I'm not working, other stuff I like to do, other stuff I have interest in, advocacy, doing stuff with SCAHF and health media as well. And our guest presenter today is Dr. Ifeoma Neye-Akogo. I'm sure we can all see her on her screen. If you can say hi to everyone.
Hi, hello.
Yeah. So about Ife, background Nigerian as well, medical education in Nigeria, related to the UK, currently doing her psychiatry training in England. Although she doesn't want me to say this, but I'm going to say it anyway. She has a wealth of experience in mental health and hematology. So today she's going to be our number one guest presenter, teaching us about depression in sickle cell disease and what the hidden links are. Our second presenter is Ruki Efejuku. Ruki, would you like to say hi to everyone?
Hello.
Yeah. So Ruki as well, background Nigeria, so you can see we're all Nigerians. Background education in Nigeria, and one special thing about this lady is she championed the first ever sickle cell disease awareness campaign in Port-Harcourt, Nigeria. So I think I can confidently say that she inspired a lot of us to do what we are doing today. Shortly afterwards, she relocated. She currently lives in Spain with her family. So today we're going to be drawing from her wealth of experience, what it takes to living with and winning with sickle cell disease. So yeah, that's just short about your presenters for today. And I do hope you all enjoy the session. I'm going to be handing over to Dr. Ifeoma now to start the presentation. So Ife, over to you.
Hello, everyone. So I'm going to be talking today about sickle cell disease and depression, the hidden link. So we don't have that much time, but I have sort of an outline that I'm going to try to follow. I'm going to talk a bit about depression for starters, like just to give like an overview of what depression is, and then what the difference between depression and feeling unhappy is, because many people don't really understand that. And then I'll talk about how depression presents, how common it is, what causes depression, and then we'll talk a bit about sickle cell and how it's related to depression. Then we'll hand over to Ruki to give us a brief talk as well. So what is depression? This is literally my favorite definition of depression, and it's one of the oldest as well. It's by Jastrow, and it's defined as a condition characterized by a sinking of the spirits, lack of courage or initiative, and a tendency to gloomy thoughts. So that basically just sums it up, what depression is, and it's pretty much self-explanatory. Now, about what the difference between depression is and feeling unhappy. Everyone obviously has times in life when they just feel a bit low or feel sad about something, like an event happens and then you just don't feel happy for a bit of time. So this is normal. But the thing is, just feeling unhappy or feeling low tends to pass after a certain amount of time. It doesn't last that long. It should not normally interfere with you doing your normal life activities, living your life normally. However, feeling low can be a sign of depression. I'd like to state that depression is actually a real illness, unlike what many people believe. Depression is not just something that you can snap out of, or just pull yourself together and get over it on its own. And to kind of explain what this, how to differentiate the two, I like to give an example of like a physical health illness. So if you have malaria, for instance, and then you have a headache as a result of malaria, and you wake up having this headache just ongoing all day, if someone says to you, go drink some water and then, just rest, it will clear. It won't, it's very unlikely to just resolve on its own if that headache is as a result of malaria. So until you treat the malaria, that headache will keep coming back. Okay, but if you have a headache, which is just because you've been stressed out, like you had a long day, you've been on the road all day, there's been a lot of noise around you, and then you've just had a very stressful day, and then you come back in the evening and you're tired and you have a slight headache, and someone says to you, just get some rest, drink a lot of water, that will work because it's just stress. And then you drink water, you rest, and you wake up in the morning feeling fine, and it just doesn't come back. And I'm sure all of us have experienced that kind of thing. So that's kind of how it is with depression and feeling low. So if you're feeling low about something that has just happened and it's just a normal, like, the human reaction to something, it's something that will pass when that event passes. But with depression, if you feel low because you are actually clinically depressed, it's not something that you can just snap out of, because it keeps coming back and it lasts for long periods of time. And it's just not something you can shake off on its own easily. So that's basically the difference between depression and just feeling unhappy. I'm sorry, I can't really see the chat. If you have questions at any time during the presentation, please feel free to drop a message in the chat and Joseph will pick it up and then we can talk about it towards the end. I would have liked it to be a bit more interactive, but obviously since we're online, we just have to try to make do with what we have. So how does depression present? There are a couple of symptoms that you experience that it's important to say are not always a sign of depression, but can be a sign of depression. Okay, so different people with depression would present in different ways, but usually have symptoms amongst the ones I'm going to list. But you having some of these symptoms does not necessarily mean that you have depression. Okay. So low mood, feeling sad, feeling very irritable, that's one of the commonest presentations of depression. Feeling bad about yourself, feeling guilty or worthless. So when you feel guilty about just some little things, you start to feel like you're a horrible person. It's like out of proportion to whatever it is that has happened. Someone who's depressed tends to feel really guilty about things and some people start to feel like they're terrible people, or start to feel like they don't really belong here, or do not need to be around, or are burden to people, and just excessive guilt compared to the event that has triggered it. Feeling worthless is also another common presentation. Low energy, feeling less able to do things. People who are depressed a lot of the time are not they just feel tired most of the time. They're not really able to go about their day-to-day activities as they normally would, because they're just not able. Some actually experience actual physical aches and pains with no obvious cause. So there's no way to explain why they're feeling pains in all over the body, but you can't just explain it. But sometimes depression causes that. Also losing interest in some activities that you'd normally enjoy. So you normally like to play sports, or you like to watch TV or hang out with people, and then you just find that when someone is depressed, they don't want to go anywhere. They don't want to do anything. They don't want to just do the things they would normally like to do. So that is one of the symptoms of depression. Losing interest in sex is another very common thing for people who are depressed. Loss of concentration, and then sleeping less or more. Some people just sleep all day. Some people just do not find it very hard to fall asleep at all, or stay asleep. And then feeling tired all the time, as I've said. Also eating less or more. So that depends on the individual, really. Some people eat a lot more when they're depressed, while some people just don't eat. Unintentional weight loss, thoughts of self-harm. So some people get to that stage where they feel so low and so sad that they actually try to harm themselves, because sometimes people feel like physical pain is a lot worse than the pain that they feel emotionally. So they try to harm themselves physically, while some others get so low that they become suicidal and they start to think they're better off dead. So these are some very important symptoms of depression. Now, people who have moderate to severe depression can also develop some very, different symptoms that are very severe, like delusions. What delusions are basically just a belief of something that is not true, but you just can't, no one can convince you otherwise. So that's basically what a delusion is. Paranoid delusion just means that you feel like people are kind of against you. You can't really explain how or why, but then just feel like everyone is against you. Like people on the streets are talking about you, or all your friends are whispering things about you when it's not true. And then people cannot just dissuade you otherwise. So delusions, hallucinations, like hearing voices that other people are not hearing, these are just like very less common symptoms of depression and tend to point towards more or less severe depression. Now, the thing is, as I said, those symptoms do not always point towards depression, but they can be associated with depression, and they usually present with depression. Now, so for it to actually be classified as a clinical depression, most of these symptoms have to have been present for at least 2 weeks for them to, and then represent a change from the person's normal state for you to actually start to think, okay, this might be a clinical depressive state. Also, the symptoms have to not be as a result of like drug or alcohol misuse or medications or a medical disorder. Because if you've taken drugs and then you start to feel this way, then we can literally just say it's as a result of the drugs. It's not necessarily a diagnosis of depression on its own as an independent diagnosis. But if it's like a medical disorder, like thyroid dysfunction, for instance, or as a result of bereavement, it might not be abnormal. So most of the symptoms will cause like significant distress or impairment of the person's normal functioning. So these are the kind of things that we look out for before diagnosing a person as depressed. Now, depression is very common. It's literally occurs in like 1 out of 10 people generally. So that means out of 10 people, 1 person is likely to get depressed at some point in their life. And it can happen at any age. However, it's common among females. I can't really say why that is, but I'm sure we can all just take a wild guess. Among people with sickle cell, depression is a bit commoner. It's usually between 27 and 35%. So that means 27 to 35 out of every 100 people with sickle cell disease will likely get depressed at some point. So that's obviously the point of this entire conversation, how common it is in depression. So just a quick overview of the things that cause depression. So these are not like direct causes of depression. They are mostly risk factors for depression, and they tend to occur more than one at the same time that will predispose someone to actually becoming depressed. Now, hormones, for instance, women who are menstruating, you notice that during their cycles, they have like different moods from time to time. That predisposes to depression. It's not necessarily a cause for depression, but then that combined with a lot of other things can trigger someone to get depressed if they have, other factors present. Family history, it's not a direct genetic link, such as sickle cell, which if you have parents who have AS and AS or SS and SS, it's not quite so clear. But if someone has a family member, direct family member who's had mental health issues, it generally tends to increase the risk of the person developing mental health issues themselves. Now, environmental factors, like things that happen to people on a day-to-day basis, losing your job, major like events in your life, things like that can trigger depression, as well as chronic illnesses like sickle cell disease that happens all through your life. It's just there with you. Things like that tend to trigger depression for some people. Life-threatening illnesses like people who have cancer or like brain diseases and things like that could lead to depression. Now, for sickle cell and depression, just an overview of what sickle cell is. So sickle cell is an inherited disorder of blood cells, basically where the blood cells, the red blood cells that carry hemoglobin, tend to be abnormally shaped. So that leads to blockage of some blood vessels that can cause like recurrent pain, some damages to some of the organs in the body, like the spleen and some other things. So people who have sickle cell tend to have a variety of medical and even non-medical complications. So people who have sickle cell disease experience recurrent acute painful episodes, and some of them actually experience chronic pain. That means pain that's constantly there for even up to 3 months. So that just gives us a bit of perspective about why sickle cell disease comes up as a major risk factor for depression. So recurrent painful episodes, chronic pain sometimes. Now, how is sickle cell linked to depression? Sickle cell and depression form this very vicious cycle because it's been established that sickle cell can predispose to depression. However, depression itself can cause sickle cell to be worse, the outcomes of sickle cell. So there was a study done in 2009 that showed that about 35.2% of people who had sickle cell disease were depressed. That means out of 100 people, about 35 people were depressed. Now, depression doesn't happen in everybody who has sickle cell, but some people who have sickle cell get depressed. And when they do get depressed, it just shows that the outcomes of the sickle cell illness itself gets worse. So depressed people in another study had more days of pain than people who were not depressed who had sickle cell. So people who had sickle cell had more days of pain, and the pain was even worse whenever it came. So this is just an illustration of that. You have sickle cell disease causing recurrent painful crisis over and over, and then this leads them, or well, this predisposes them to getting depressed. Now, depression itself, if you see the double-edged arrow, depression itself causes even worse recurrent pains, like it causes the pain to be more frequent. Now, when depression occurs, it also causes the actual pain when it comes to be a lot worse than it would be if the patient was not, or if the person was not depressed. So I don't know if you've got a grasp of what we're trying to explain here. So sickle cell leads to depression, depression leads to worsening of the sickle cell presentation itself. At this point, I would like to give way to Ruki, who's going to come and give us, I've talked about like the statistical links between depression and sickle cell disease, but why does this happen? Why is this link always there? Why do many people who have sickle cell disease tend to end up having depression? So I'll just allow Ruki to come over and have like more of a presentation from point of view of someone living with sickle cell disease, what kind of challenges they tend to face on a day-to-day basis. That's okay. Ruki?
All right, thank you, Ife. So like Dr. Ife said, it is indeed a vicious cycle. I came across a study once that showed that more than 70% of adults were living with sickle cell disease had sleep disturbance, and of this 70%, 21% showed evidence of clinical depression. And it was noticed that the 70% that had the sleep disturbance and the 21% that had clinical depression, they were correlated. So, we all start thinking, what does this mean? Does this mean that if you were living with sickle cell disease, you are bound to be depressed? That's why we're here. We're here to uncover the hidden link. And to do that, we need to ask the question, why? So when you ask the question, why?
All right, just
yeah, just one moment there.
All right. All right.
Okay, so we'll back up. When you ask the question, why do people living with sickle cell disease or sickle cell disorder get depressed? And the moment you start digging and you ask the relation, you find that you get this response from people living with sickle cell disorder. The response is always, why me? Why me? I know a lot of us here, or some of us here, are actually living with sickle cell disorder. And I would like to ask, how many of us have asked this question before? Why me? Why do I get to be the one that have sickle cell disorder? Why do I get to be the one that go through these pains? Why me? Why was I born with it? And it got me asking, and it got me asking others. And I've noticed that while many people who are living with sickle cell disorder are depressed, and or people who have been depressed, it all boils down to a feeling I've called, or I've tagged less, a feeling of less than. And all this less than started with why me? Why am I the one that get to have sickle cell disorder? Why am I the one that can't complete my studies? Why am I the one that have to take drugs every day of my life? Why am I the one going through this pain? And the moment you start thinking that, or you start asking that question, it means that you have a lot of challenges at that point in time that you're going through. Now, I'm not saying that you are depressed, but I'm just saying that it's a cue to get help, talk about it, rather than let it grow and let it fester. So let me explain more with some real life stories, how it all started with them and how they overcame it. Now, but before I get into story time, I would like to ask, and please leave a comment in the comment section, in the chat section. I would like to ask, it's there, right? Do you think children living with sickle cell disorder can get depressed? So it's a question. You could just leave your answers in the chat section.
You guys can put your answers in the chat section. Yes, we have a yes, they can. Another yes.
Another yes. Okay.
Yeah.
While the answers are still pouring in, I will get down with the stories. Now, all the stories I'm going to give you today are real life stories, but they are all anonymous. So you will not have names, and we'll just give them alphabetical names. So I'll start with example A. Now she says, I have never had negative experiences from having sickle cell disorder, aside the pain and all, till I joined the workforce. I was sacked twice, not for incompetence, but because I had sickle cell disorder. I would have crises, and by the time I returned to work after a bout of crisis, I would have my sack letter waiting on my desk. Recently, I had to resign from a juicy job just because I kept pushing myself to compensate for my genotype. And well, as we all know, the body doesn't do well with stress. After my resignation, I fell into a state of depression because how do I become independent? How do I further my career when I'm constantly defined by my genotype? So I once went for an interview and it was going well. It seemed like I got the job up until I mentioned my genotype. And I did so because I really didn't want a repeat of them letting me go after they found out. And after I told them, they told me that the job might be too stressful for me. And that's how I was let go. I was really down for a while. Luckily, I had a really good support system. My dad helped, and I remember telling myself, look, it's not the end of the world. That I'm not there yet doesn't mean I'm not moving. I constantly encouraged myself and also started planning and working on the plans. I'm not 100% today, but I don't feel as bad as I did. So, example B. It goes, so I'm generally a positive person, always looking on the bright side. And because I don't get sick so often, I never really get depressed. But when I got my AVN is avascular necrosis. That really just means the death of bone tissues due to loss of blood supply. So like your bone tissues are dead, and it's really painful. You have to do surgery, and it's a whole mess. It's one of the complications that comes with having sickle cell disorder. So the diagnosis really affected me. I would read about it online and just cry and just be lethargic. But what really gets me going is the feeling that I've always had about me being in this world for a reason. That there's a higher purpose for me being there, and I have to fulfill it. I draw my attention to the parable of the 10 talents, where three servants were given talents, and the master was cross at the servant who was given a talent but did nothing with it. He didn't double it. It tells me that no matter how little you have, whether it's health-wise or money, you must use it for good. Make it count. So no matter what, I'll just keep doing it as much as I can to fulfill my destiny here on earth. Example C. So the first one we have, in the case of example A, we see that there was just a lot of stigmatization at work that really brought her down, made her fall sick. She was sick for about a year. It was really, really terrible. Back like Ify said, it was just a vicious cycle. She was sick, she gets back to work, and she falls ill again. She gets a little bit of negativity. She's sick again. She gets back to work. So it's just the vicious cycle. And then in example B, we can see that when you have complications in addition to your pain, sometimes it's just too much for one to handle. So, well, down to example C. The worst thing that has happened to me was feeling depressed and having crisis at the same time. It's usually one time of my life I don't really like talking about. This was my junior secondary school days in JSS3, preparing for my final exams, when I had crisis that almost took my life and left me bloated. I had to forfeit my examinations because I couldn't move from the bed. I was hospitalized for 3 months, all the while with excruciating pain, tons of drugs and injections. After going through it all, I get home to hear the lies that was spread by my cousin. She said I was pregnant and went for an abortion. This was easy to believe, as my body was swollen. Everyone believed her. The rumor spread to my school, to the church, and people began to sneak up and point at me, call me names whenever they see me. Trustworthy people. It was too much for me. I locked myself up, and my daily thoughts were constantly suicidal. At this time, I was fortunate to join a sickle cell disease center. They helped me and gave me hope again. So I plunged myself into the center, and that helped to drive away the thought of killing myself. That period was hell, but thank God for the doctors and nurses from the group. I was able to pass through that stage and open new chapters in my life. The next one says, I grew up ignorant of what I carried until about 18, 19 years of age. That was when I knew it was sickle cell disease. Of course, I felt ill every now and then, and I knew something wasn't right. I had broken my arm twice before I was 10 because I wanted to play football. I had a bad hip as early as 12, a neuropathy at about the same time, and those annoying pains every now and then. My parents will mix their care for me with their frustration and anger at my ignorance. Compared me with other people living with sickle cell disorder who were doing better or worse. Insulted me for being callous. Still, I would recover and go back to Carlos Miller. I just didn't care. Looking back at it, I think it was because I hated the idea of being different in a bad way. I was angry that I didn't get to swim or ride a bike like my brothers. I was angry at my mom. I was angry Momsi was on my neck with the pampering, carrying food and water everywhere, even to church. We've all had that. I guess my first relationship with sickle cell disease was not pain, it was anger. Eventually, I paid little attention to hydration, ate junk when I could, and or whatnot. And a crisis will happen, and it always put me back to square one. Then I was a spirikoko. Spirikoko just means very spiritual. So I decided maybe this type goeth not by prayer and fasting, but by prayer and fasting. So as I began, I prayed, fasted all over again. I did all the fellowship things. In the end, crises popped up every now and then. Each time I felt back to square one. Back and forth was my life until 400 level. Then things began to get scary. The pain would never stop, and I had one nasty experience. I would definitely not share that here, just call it one of complications. After that incident, I had to agree that I had a serious problem. What happened after that was even more anger and bitterness. I asked, why me? What did I have to do to suffer this? And blah, blah, blah. At this point in my life took a wrong turn, apathy and depression. Fast forward to after school, now he's a doctor. They expected him to take care of himself, they said. Surprisingly, I recorded more crises my first 12 months after school than my last two years in school. I worked in a hospital and people hardly knew I had sickle cell disorder. I still regarded it a shameful thing to tell. After all they would do is look down on me. But you see, secrets never hide, especially in a hospital. Today I'll become a doctor, tomorrow a patient. You can imagine how embarrassing that was. Eventually my colleagues knew, and my parents couldn't understand my problem. But I knew what it was. I was angry and bitter. You fall sick so much that in the end, you don't care if you fall sick anymore. I think my frustration peaked during that year. I realized my life was on a downtoll. I would always hide myself and lock myself in a hole. I was a miserable doctor. Things started to change when I had crisis that sent me to the hospital for 7 days. I had ACS and was transfused, something I've only done once in my life. Now, why that was an eye-opener, I can't say for sure. But for the first time, I was truly scared of dying. And after that, I started to read all I could, started to know the facts. I started facing the harsh reality that if I was to have a fighting chance, I had to control my mindset and my life. Stop the bitterness, anger, and apathy. I got more exposed when I started consulting at a support center. Now, for my story, we don't have much time left, so I'm just going to run through it.
Yeah,
This is my
exactly. I was just thinking of how to tell you. We have another probably 5 to 10 minutes to finish the talk, so we can take questions. Yeah.
Yeah.
Good.
So I have to run through it. So this is my story. I can't rightly say that my family has not been supportive or loving. That would be a blatant lie. They've been really supportive. But there was a time when I did not feel the support and overwhelming love. I think I was about 6 or 7. Now, at that age, you're at that age where you can do chores, they can send you on errands. And I remember that whenever I'm sent to do something, I don't know, for whatever reason, that's the period I'm in pain. And, I'll tell them I'm in pain, and they would say I was making an excuse, especially since all I'll do is just sit and watch cartoons. But trust me, I wasn't making an excuse. My mom and aunt would complain and go on and on about how I don't want to do anything, till I gradually felt useless and in everyone's way. See, I was 7 years old, so let's just know that I wasn't thinking straight. But my 7-year-old self felt there was nothing I would say to them that would make them believe me. I was a burden to them because I was always ill, not strong enough to help them, and then I'll fall sick and everyone has to come visit me in the hospital and run helter-skelter. I felt I was a burden, and I felt that if I die, everyone's life will become better and I won't be in pain anymore. Let's face it. If I die, my mom will probably remarry because I was the one who ruined her life, and I'm continually ruining her life. That was what I felt. So I wrote a letter to my mom and gave her all these reasons I just said out. I told her I was sorry. I told her I wasn't lying. I was in pain, that she should move on and have a better life, and she would have other children. I even sealed it with my blood because then, we watch cartoons and then we're like, oh, she won't believe I wrote this. So I put my blood in there, and I had this grand idea that they were going to carry out a DNA test. Well, So I hid the letter. And for weeks, I tried killing myself. Believe me, I tried. I drank everything. Every cleaning agent, every harmful agent. Who remembers Isaiah? That's Isaiah that they used to clean toilets back in the day. I drank it. But I wasn't dying. So 7-year-old me reasoned, if I cut my wrist and bleed, cut it hard enough, deep enough, and I'll bleed to death. But I had to do it on the day when no one was around so that they won't rescue me. So I planned the D-Day. And guess what? 2 days to the D-Day, my mom that never cleans that shelf has not been cleaned in 2 years where I hid my letter, cleaned up that shelf. And when I got home and discovered that the shelf was clean, of course, definitely I ran and started looking for my letter. I couldn't find it. I was so scared because my mom doesn't joke. She doesn't play. She does 3 things. Either she beats you, she takes you for prayers, or she beats you and takes you for prayers. So I was so worried and scared. So
5 more minutes.
But my mom surprised me, and she never talked about the letter once. She just asked me to tell her whenever I'm in pain and that she will believe me. And she made me understand that I wasn't a burden to her. From that day on, my mom put an effort to study my deposition whenever I was in pain. She always knew when I was in pain before I opened my mouth. My family never made me feel like I was lazy. And they always just knew that if I'm sitting in front of the TV quiet and focused, she's in pain. So, they became so supportive that I knew that the only way to repay them was to leave. Now, let me summarize this with something someone said to me. She said, though I can't remember the first time I got depressed, it has become recurrent. I've experienced depression over the years, and several factors have contributed. They include feeling unloved, feeling like I haven't achieved much, feeling like my efforts are wasted, being stressed, being body shamed, having conflicts with others, not being financially stable, having complications, finishing school and not getting a job for years, health issues, basically just feeling like things are not working out the way they should, or the way they would have wanted, or the way I would have wanted. And she says how she deals with depression, basically just focusing on the good, doing what makes her happy, directing her energy towards working on the things that she wants to achieve, taking medication to stay healthy, getting support from loved ones, and just being grateful that she's alive. So from the stories that we have heard, we can infer that while living with the pain that comes with sickle cell disorder is enough to push someone to depression, but other factors can contribute. And the factors like feeling of stagnation, like I said, failed support system, guilt, anger, body shaming, complications that result from sickle cell disorder. So what do we do when we find ourselves in this position? What do we do? What do we do now? We have to find our center, find your will to live, find what grounds you, find something to hope for. If you have heard through the stories, and I think I would just leave the stories with SCAHF so that you can read through them again, you'll find that each of them had, something that kept them going, be it a support system, be it higher purpose, be it God or whatever, something kept them going. So find that it's not a one solution fix all. Find what's particular to you and then do it. Now I'll hand over to Ifeoma so she can tell us what can be done from a medical perspective. And always remember that no matter what anyone does for you, if you don't put an effort, there's no getting better. Thank you.
Thanks, Ruki.
Yeah,
So I'm just gonna quickly run through the remaining few slides. So Ruki has given us more of an insight into what goes on basically in the life of someone living with sickle cell. So the question is, what can be done when you start to feel like you're really depressed and getting depressed quite often? The first thing that everyone needs to remember is talk to someone. That is the first and most important step. If you feel depressed, talk to somebody. If you have a support system in your family, or you have a friend, or you have friends, you have a support group, talk to somebody. If you don't have anyone to talk to, reach out to a doctor. There are some numbers I'm going to share at the end of the slides. In Nigeria, there's this Mentally Aware Nigeria initiative that I once tried to work with. They have a phone number you can actually ring at any time of the day if you're feeling low, just to talk to somebody, because that is the first step to getting better. Now, self-care is how you take care of yourself through your diet, exercise, daily routine. So when you start to feel depressed, you find out that it's a lot harder to keep up with the things that you normally do. That is actually the time when you need to try to keep up with those daily routines, because they will be the ones to help. Those daily routines will help you to get out of depression. If you give up all your daily routines and lay in bed all day and just just remain so low and not talk to anyone about it, chances are it will just only get worse. So it's quite important to remember daily routines, keep your diet up, drink a lot of fluids, eat fruits, vegetables, go for a walk, simple exercises, go for a walk, hang out with somebody. Those kinds of things on a day-to-day basis can help people get through depression. Now, what happens if all those things don't work? Because obviously, if you have like a mild to moderate depression, depending on how bad your symptoms are, you might need some medical care. So what will a doctor do for you, for instance, if you presented to them with symptoms of depression? There are three main ways of treatment, depending on how severe, and these are basically individualized depending on who is coming with depression and what they're coming with. Talking therapy for depression is one of the commonest ways. It's just basically when you have a professional speak to you and explore all the things that you're going through, the challenges, the physical, emotional challenges, and help you develop coping strategies to help you get through the challenges you're going through, and it helps you get through depression generally. So there are different kinds of talking therapies. There's cognitive behavioral therapy, that's CBT. There's group therapy where they talk to different people. There's psychodynamic. There's so many different types. Well, specialists will let you know which one is most suitable for you if you needed it. Now, if that doesn't work, and sometimes in combination with talking therapy, some people might need medications, basically antidepressants. There are different kinds of antidepressants, and which one will be suitable for which person will depend on what they present with and some background medical history, for instance. Now, it's important to state that not everybody needs medications for depression, and then some people need medications for depression for varying lengths of time. So you can take medications for depression for a short time and then stop it when your depression is actually treated. Some people end up having medications for really long amounts of time. So it just varies, but it's just to be aware that some people actually take medications, get better, and stop. So yeah, that's an option that you might be presented with. Now, ECT, brain stimulation, is a very more or less drastic way of treating depression for people who have really severe depression and are completely unable to function normally. So it's just like an actual physical brain stimulation with some equipment, but that is not very commonly used for just moderate or mild depression. So it all depends at the end of the day on what is suitable for what individual. So before I round up, I just thought I might just throw out there some recommendations. Generally, everyone here has a part to play in mental health awareness among the general public. Not just in Nigeria, all over the world, the mental health is still kind of a taboo topic for people. With people, feeling too ashamed to present to like a hospital to say they're depressed or they need help with their mental health. It's something that we need to change. And that change will actually start with just you and I, like just regular people, encourage people to seek help when they have problems with their mental health. If you feel like you're sick, you have malaria or you have a fever and you feel it's necessary for you to speak to a doctor about it, why is it less important for you to speak to a doctor about feeling very low and so depressed that some people actually think of committing suicide? So let's try to encourage that help-seeking behavior among people and remove the stigmatization that occurs with people going to mental health facilities, because it's just part of healthcare. Also, more support for focused sickle cell organizations. I don't know who's in here. We might have some big organizations and government facilities, represented in this webinar. But sickle cell organizations like SCAHF are actually helping to promote like tailored mental health care delivery and awareness about the needs of people who have sickle cell are very important. So if we can get more support for them so they can actually improve the mental health care delivery for people with sickle cell disease, that would actually be really helpful. And formal and informal sickle cell group meetings is another very helpful way for people to deal with depression if they have sickle cell, because it creates like a comfortable environment for people to share experiences, like with people who can more or less have like similar experiences. Some people find it a lot easier to cope when they're able to talk about these things with people in similar situations. So in conclusion, basically sickle cell, as we've seen, can be associated with depression as well as a variety of other mental health disorders that I'm sure will be talked about in other episodes of this series. And mental health illness in sickle cell disease does lead to poorer outcomes, and so really needs to be looked after. So mental health care is necessary in the holistic care of people with sickle cell disease to basically improve quality of life. Now, I've just shared a phone number of the Mentally Aware Nigeria Initiative. It's online, I think 247. If anyone needs sort of someone to talk to, sometimes it's easier for people to talk to people they don't know about things that are going on if you don't want to talk to people that are actually close to you. So that's the contact of Mentally Aware Nigeria Initiative. And online, I'm sure wherever you are, you will be able to find contacts of people who are willing to listen. And thank you very much for listening. And I think we can have a discussion and take some questions now.
Okay, thank you, Ife, for that wonderful presentation. Thank you, Ruki. You guys have done so well in dissecting this topic. So while we wait to collect the questions from the audience, just a couple of things that came up while you guys were presenting. So Ife, this is for you. We've said so much about this depression in sickle cell. Just to be sure, can we say that everyone who has sickle cell disease should expect to get depressed at one point or another? Or because one of the reasons why we do this is not to scare people. I always say that to be educated is not to make you scared in any way. It's just to make you know what's happening so you can make the best decisions. So should everyone with sickle cell expect to get depression at some point in their life? Yes, no?
No. So that's
No,
the simple
okay.
answer. However, we just showed some studies actually that show that just about 27 to 35%. So that means out of 100, 27 to 35 people who have sickle cell might get depressed. How it's not you for someone who has sickle cell, obviously with the recurrent crisis and all the challenges that they face, it's very common for you to actually feel unhappy or feel down from time to time. But that doesn't necessarily mean that someone with sickle cell will definitely get depressed. It's just something to look out for.
All right.
Okay.
Just if I can jump in there.
Okay.
If I can jump in there, that's why I said, if you remember in my slides, that the moment you start asking yourself, why me? Why me? What am I doing wrong? Why am I the one that's ill? That's usually your cue to go talk to someone, because it just goes to show that you're going through a lot of challenges at that point. Some maybe too overwhelming for you to handle, and you just need to relieve stress, because like Ify said, lots of challenges we go through facing sickle cell disorder, and then you have complications, you have this, you have that, so it might get overwhelming. Just talk to someone. You generally, okay, let me put it this way, sickle cell disorder doesn't mean you would have depression, but if you don't take care of yourself, you don't take care of your mental health, you are not proactive about it, you might fall into depression.
Excellent. Good enough. You've answered one of the questions that I had lined up here. So one of the first things to actually watch out for is that constantly asking yourself, why me? Yep. Okay. So Ruki, you gave a lot of examples and you actually said a lot of things. Now, going back to the topic of today is the hidden links. So can we say those risk factors you pointed out, those are the hidden links between sickle cell and depression? The issue of stigma, the issue of guilt, the issue of, we mentioned quite a lot. We mentioned stigma, we mentioned guilt, not feeling enough. Yeah. Can we summarize for the audience that those are actually the hidden links between sickle cell and depression? Yeah.
I think they are because, when you just feel less than your peers, and then you're always falling ill, and then you now have you're of course you're angry. Do you know, at one point in time I was angry at the Lord. Couldn't be angry at my parents because I love my mom, but then you're angry, and then you feel you're stagnated. Sometimes you feel like, okay, they're body shaming you. I felt it one period, and then I came back to school, and everyone thought they said I had HIV. Now I'm not, stigmatizing HIV, but it made me feel bad. So when you have all these things, and it's not just that it comes and it goes. For someone living with sickle cell disease or disorder, this is something that they have to go through every day of their life. Is it that they are going through stigmatization, or they are going through body shaming, or they are, having failed support system or guilt or something? Yeah. When you add this with the crisis, definitely. Yeah.
Okay. And this one goes to both of you quickly. We both know that in Nigeria, talking therapy, it's not really one of our strongest areas, because, I mean, the courage to come out and talk is not there. And also, when you are coming from an area that has a lot of social, religious and cultural issues, yeah, when you come out and talk, people tend to label you. So if I know you mentioned, you guys both mentioned speaking up, opening up, and talking therapies. But given the fact that back home, it's not one of our strongest areas, how do we advise we break the barrier?
Well, for starters, I'd just like to say, you're right, it's not one of our strongest areas in Nigeria, talking therapies, psychotherapy generally. However, contrary to public opinion, we do have psychotherapists in Nigeria. There are psychotherapists, there are psychologists, and there are psychiatrists. Now, when you want to talk to someone, just as I said, you can start by talking to people around you. Like Ruki said, your family, if you have a support system, or anyone that you feel you can confide in. If that's more difficult for you, then go to a professional by all means. Or if it's not helpful, go to a professional. There are professionals in Port-Harcourt, in Lagos, in Benin, Edo, wherever you are. There are psychiatrists, psychologists and psychotherapists. So you just need to, go to someone and present. If you just go to your regular doctor and say to them, look, this is what I'm going through. Is it possible for you to refer me? You could get a referral. There are private practitioners as well. The number that I put out there, the Mentally Aware Nigeria Initiative, if you want to just talk to someone, they are there. So these are anonymous people who will keep your discussions confidential. Yes, so you should not be afraid that, oh, they're going to broadcast everything you say. It's confidential information, basically. So the talking therapy, when I say actual talking therapy, like psychotherapy, CBT, it's actually a professional thing that is done by psychologists, psychotherapists, psychiatrists. So they are trained to actually help you work through issues and develop with you coping strategies to deal with things that you normally face. So there are in Nigeria a lot of psychiatrists and psychologists.
Do you have anything to add to that?
Well, like you said, it's not easy. I can imagine when I was in Nigeria and someone tells me go to a psychiatrist, sometimes it's not easy coming from our background and religious belief, but it's the right thing to do. Just get someone to talk to. But if you think that, it's going to be difficult for you to talk to a psychiatrist, do what I do. Have someone that you can talk to. That it's your person, the person is your support system, or you can form a group. You can form a group, and of a group of people that go through the same struggles with you, and just talk to each other and encourage each other. Let the group not be a group for complaining and feeling low and increasing the depression, but rather, when someone comes to you for help, you guys are facing the same issues. You should be able to say, okay, let's talk about it. You'll get better. And, just give encouraging words. And when you see that the person is not doing so well in that group, then you can take it further and say, why don't you visit a professional? Why don't you go to the hospital? Why don't you talk to a psychiatrist? I believe that if we talk it out, at least with the professionals, we will get better. We won't have such high statistics of people that are living with depression.
All right, thank you very much.
I'd just like to say as well, that's what I was saying in the recommendations thing.
Yeah.
Don't see going to a psychiatrist or a psychologist as such a big deal and very rare in Nigeria, because in the teaching hospital, just like you have cardiologists and hematologists that are specialists in these things, you have psychiatrists just as available as you have those other people. It's just people do not like to say, I'm going to see a psychiatrist, and that's something that we need to change, because they are just specialist doctors, just like all the other specialties. Except
yes, don't be scared to see a psychiatrist. I mean, look at Dr. Ife. I mean, if this is your doctor, won't you be happy to see her? Anyways, I'm sure we all get the point. So because of the restriction of time, we can take questions from the audience. No questions in the chat box. So if you want to speak up and you have a question, you can unmute yourself and ask. We will take questions in the next 5 minutes.
Hello, good evening. Can you hear me?
Yeah.
Yes, we can hear you. What's your name?
Okay, my name is Agbi. I am actually in Ibadan, and I've been listening to you, and I like what the topic is going on. I'm really grateful that for us warriors, we get to hear this kind of thing that encourages us, because we know that we are going through a lot of things mentally, physically, and that most times we don't really want to share it because we feel like nobody would actually understand what we are going through. I don't know if I'm speaking somebody's mind.
Yes, you are.
Okay, thank you so much. So I don't know. This is my belief. I don't know if anybody else believes about. I mean, with me on this, or if anybody's with me on this table. But I have this feeling that I don't think there's any psychiatrist or any mental health specialist that can actually fix my issues, or that can actually understand what I'm going through. Because number one, most of the guys, they are just okay, they know theory, they have read this thing, they have been through school and all of that, but most of them have not really been through my experience as a person. Okay, so I'm a warrior, I'm a graduate, I've worked in an organization, I've been about 3 multinationals, and I've traveled in so many, like about 6 countries and all of that. I just have a feeling that by the time I sit down with you, I'll be like, okay, you know what? Okay, so this is my issues. I have this issue, like, okay, since when I was growing up, I feel like I'm not always enough, because I feel when I was a warrior. Hello, can you hear me? Is everybody hearing me? I just want to
we can hear you. Yeah, if you could just quickly summarize the question so we could hand over to Dr. Ife. I think this question belongs to her. Hello?
Hello?
I just feel like, okay, so this is my issue. Let me cut the long story short. I feel like there is no any psychiatrist or mental health specialist that can help me.
Understand
How
you.
do I
How do you overcome that barrier? Yeah?
Confidence in these guys. Hello?
Yeah.
Okay.
I wish. Okay, thank you so much. At least someone understand me. So
Okay,
I
thank
think the issue is, yeah, I think the issue is, so he has tried speaking to psychiatrists or mental health specialists, but he feels there are just some areas of understanding they don't have when it comes to dealing with sickle cell disease. So how do we break this barrier? If over to you.
Okay, so I'm not really sure who you've spoken to be honest, and I can understand that obviously it's not to find a psychiatrist who understands what you've been through because they have been through it will be quite hard. Well, it's important to state, for instance, now I'll just give an example. The hematologist who is actually helping to treat sickle cell disease has probably not had sickle cell before, but they know
you are right. You're right. Exactly what I'm talking about.
And they can help with the treatment of that. So that's how it is with psychiatry. Now, what I want to state is now, depression itself, presents with symptoms that are kind of standard for depression. Now, sickle cell disease can be a cause of depression. However, the symptoms of depression are the same. I don't know if you understand what I'm saying. So now someone who has, for instance,
actually do.
Yeah, so if someone who has, for instance, end-stage cancer or like a blood disorder or has gone through some major life events and has like some family history and comes with depression, they could feel exactly the same way you feel without the sickle cell pain, obviously. But when I'm saying emotionally, do you understand? So now those emotional,
yes, I do.
that feeling of being low, that feeling of, you know, not having interest in anything, guilt, you know, wanting, sometimes some people want to kill themselves. Those feelings are the things that the psychiatrist wants to hear about. Now they can't try to understand where you're coming from. Obviously, like you've had sickle cell disease, you've had all these challenges. It's not something that you can cover in just one consultation with somebody, and then you just tell your entire life story, and then they will be able to put themselves in your shoes and understand. It's not easy. I understand it's very difficult for someone to actually be in your shoes if they're not. But with communicating with them and explaining what feelings you're going through can help them help you to develop like coping strategies to go through those feelings that you have. And it's important to know that they have actually studied most of the emotional presentations of depression. So they're helping with the depression. Remember that what they're helping with is the depression. They're not able to take away the sickle cell disease because we can't do that. We can only help you to get through these emotions that you're feeling that are actually affecting your life, and help you develop like coping strategies to actually get through the depressive episode. But that's why sickle cell treatment, it's like a multidisciplinary thing. It's not just the mental health practitioner, the hematologist, the cardiologist or respiratory physician, whoever is necessary to help you with what you're going through needs to work hand in hand to actually help you get like a better quality of life. So while you're treating physical symptoms that you're having, the psychiatrist is there to help you with the emotional and the mental part of things. So they don't have to have been through what you've been through for them to actually help you to cope with the things that you're experiencing. You get what I mean?
So I do. I really appreciate you. I don't know. I think maybe someone else wants to say something, but before that,
we're actually short of time, to be honest. I think we are back.
Okay.
It's about an hour now. I'm so sorry. I have to.
Yeah.
We have to stop it there. We'll just take one more question. If you have anyone else who has a question, then if not, I think we've come to the end of the session. Any other person with a question?
Yes.
Any other person who has a question?
Yes.
Okay,
can
you introduce yourself and just quickly let us know what your question is and who it's been directed to? Is it Dr. Ife or Ruki? Thank you.
My name is Joseph. I'm from Port-Harcourt. My question is directed to the last speaker.
I think that's Ruki, yeah?
Yeah. Can sickle cell be eradicated?
Can what?
You heard me, right?
Can sickle cell be eradicated?
Yeah.
That's a dicey one. Ruki, well, it was addressed to you, so let's hear your. We all have different views about this, so Ruki, let's hear yours.
Yeah.
Oh, well,
because to be frank, the pains are too much, you know. It's not nice. So I'm asking if it can be eradicated. Is there a scheme, is there a plan or something that can, you understand what I'm saying?
Joseph, I need to ask you one. Let me throw one back at you. Have you ever seen an hematologist?
Myself?
No, not you. The guy that asked the question.
Okay, yeah, Joseph, that's for you.
No, okay. Now that's what I would advise you to do. Go to the teaching hospital in around where you are, and then go to the hematology department and then speak to them. There are so many scientific breakthroughs that are out there today that you can help take away, in air quotes, sickle cell. So the stem cell, for lack of time, I can't run through all of them. They stem cell, and they're just a lot. Just speak to them, and there are also drugs that can help, with the pain, that can help ensure that your fetal hemoglobin is higher, so that you have less recurrent crisis. All right. And can everyone hear me?
Yeah, we can hear you. Okay. We can hear you. Are you done?
And I just want to add, for the last guy that asked the question to Ife, yeah, you should I feel the last guy really doesn't understand when to go meet a psychiatrist and when to meet a support group. Now, you should have a support group for people living with sickle cell. Please, I'm speaking to everyone out there. Go look for a sickle cell center, sickle cell disorder center, and join a support group so that you can discuss your problems, you can discuss your issues, and then have people that would uplift you. Because you go to a psychiatrist when you are, and then you are, if you are clinically depressed, but you can avoid getting to that point where you are clinically depressed if you don't plunge into depression. Am I making sense here?
Yeah.
Yeah,
Okay.
yeah. I think you're referring to that question to me. That's the question I asked about depression and meeting specialists who do not understand what I'm going through. I thank you so much. I really appreciate that. I hope that I will get a lot of support where I am in Ibadan. Actually, I don't know any sickle cell group. Please, you can reach out to me on my Twitter, Facebook, or Instagram handle. Or if there's any, just let me know. I can see some numbers here I can call. But if there's any.
Okay. Ajibuba, thank you so much for your question, and we hope you do get the help you need. Before we round up, just to throw in my opinion, the last question, I think there's a difference between eradication and cure. Can sickle cell be eradicated? I'll be blunt with you. I don't think it can be eradicated, because if you know a lot about sickle cell, and if you really read a lot about it, you will know that one of the most common theories is that sickle cell is a byproduct of a coping mechanism, the fight against malaria. So I don't think sickle cell can be eradicated, but can it be cured? Yeah, I think that's the angle Ruki was coming in from. There are a lot of efforts being put into the research and cure for sickle cell. So hopefully one day we will get that cure. And but will it be eradicated? Ask yourself, how many diseases have been eradicated in this world, in this imperfect world we are in? Let us wait for the new heaven and the new earth. Okay, so I think we'll stop here. We are ahead of time. Thank you. I would like to say thanks to everyone for coming online. Thanks for participating. Thank you, Dr. Ife, for such a brilliant presentation. Thank you, Ruki, for dissecting the entire issue, for giving us the hidden links. I believe this session is being recorded, so for those who missed it, you can always refer them back. I think at some point it will be uploaded on the SCAHF YouTube channel. Yes, the SCAHF YouTube channel is up. Tell your friends, tell your family, those who want to know about sickle cell, they can go on YouTube, like, share, comment. Okay. At SCAHF, this is what we do best. We educate about sickle cell. So I think it's a wrap for today. Thank you, everyone. Thanks for participating. Thanks for the questions. And stay well. Enjoy the rest of your weekend. God bless you. Okay. Bye.
Thanks, everyone.
Thank you.
Bye.
Bye.